per CMS conditions of participation. Hospice care is a benefit under the hospital insurance program. To be eligible to elect hospice care under Medicare, an individual must be entitled to Part A of Medicare and be certified as being terminally ill. An individual is considered to be terminally ill if the medical prognosis is that the individual's life expectancy is 6 months or less if the illness runs its normal course. Only care provided by, or under arrangements made by, a Medicare-certified hospice is covered under the Medicare hospice benefit. The hospice admits a patient only on the recommendation of the medical director in consultation with, or with input from, the patient's attending physician, if any. Hospice agencies vary in their hospice admission protocol. However, based on CMS compliance for hospice, the following procedure is usually adhered to. 1. After receiving a referral for hospice, referral, which is to be completed on the new referral inquiry form, is endorsed to the intake department for determination of eligibility. 2. Next, all referrals should come with a 1. Face sheet, 2. History and physical, 3. Medication profile, 4. Physician's notes and orders, 5. Nurse's progress notes, if available. Order must be read hospice to evaluate and treat. 3. Before starting admission, the hospice program must be discussed thoroughly with patients by the marketing/hospice liaison and the conversion team. Patients' rights and other pertinent information must be thoroughly discussed as well. Hospice consents must be signed prior to admission by conversion team. If an RN is requested to explain more on the clinical side, an RN will accompany the conversion team and admit the patient when they sign. 4. Importantly, RN admission must be done within 48 hours from the signing of hospice consent or notice of election, NOE. Admitting RN must complete admission and medication order form on EMR, signed and dated, and must fax/email to office. 5. The admitting RN must call the attending physician and/or the hospice medical director, informing them of the hospice admission and the hospice diagnosis used, and indicate on the admission note that the attending physician's and medical director's verbal order to admit to hospice were obtained. If the hospice referral does not have an attending physician, the hospice medical director's verbal order to admit to hospice will suffice. 6. Let your agency know about your admission report within 12 hours from admission, together with the accomplished admission and medication order completed and signed by admitting RN. This is to inform the hospice team that the 5-day window for initial assessments from the social worker, chaplain, bereavement coordinator, and volunteer coordinator have commenced and must be accomplished right away. 7. The admitting RN will document admission chart within 24 hours, so SW and chaplain are aware to complete their initial assessment within 5 days from admission. If the comprehensive assessments by RN, SW, chaplain, and bereavement are not completed within 5 days, the hospice agency cannot transmit the notice of election, NOE. The hospice agency will not be reimbursed by Medicare for services provided. And worst is the hospice agency will be deemed non-compliant. This is an LTAG during survey and/or will be an ADR for the agency. 8. As part of the comprehensive assessments for hospice admission are the individual assessments of the social worker, chaplain, bereavement coordinator, and volunteer coordinator. These assessments must be entered on the agency's EMR within the 5-day window from admission. So if the hospice professional went to assess on the 5th day, their assessment notes are due right away. 9. The volunteer coordinator must call patient's PCG/POA to discuss the need for a volunteer and determine if there is a need. If a need is identified, the volunteer coordinator will coordinate with the clinical team and RN, and they will assign field volunteers and discuss what will be the scope of their responsibilities. 10. The hospice clinical team must submit within 5 days or less from the start of care, or SOC, the notice of election or NOE through their EMR portal. Any delays in the submission of the NOE will result in non-payment by CMS for hospice services rendered by your agency. To put is simply, no NOE, no reimbursement. 8. One of the most important processes is for the hospice copy officer to submit the hospice item set or his report as soon as possible from any hospice admissions. This process can be done through the CMS portal under QIS. The hospice agency must have a delegated person who has access to QIS to submit his reports on a regular basis. Thank you very much for taking time to view this hospice topic on hospice, the dying process and the hospice admission process. We do hope that we will be seeing you again on our future presentations about the hospice program. This presentation is brought to you by Etecon Healthcare Consulting Incorporated, your partner in healthcare business formulation, operations, and compliance.